ಎಲ್ಲರಿಗೆ.
Well, a very good morning to you. It is Friday, the 22nd of July, 2022. I come bearing good news. The Ghanshyam Medical Camp is back, a free medical camp that shall review patients in the fields of maternal health, child health, dental care, eye and optics, and of course there will be a special consultancy on cancer. So this is definitely good news on a good morning Friday as we count down to 1st of August. I do not know much about it, but I have those who have organized it, those who have come here to change the lives of many who are suffering, and I'll have them in studio with me. I'll introduce them. Victoria Bagai is my name. I'll introduce myself first, and I'll start right here next to me is Ramesh Halai, who's a secretary event organizer. Right next to him is Mr. Bipin Pindoria, the medical camp organizer, and of course, last but not least, not new to our faces, is Nunda Ezra, the medical doctor at Mengo Hospital. A very good morning to you, gentlemen. How are we doing today?
Good morning.
Good morning.
It's a very exciting day. I like to hear of free things, especially the ones that are making a good impact on Ugandans, on people really. We love to hear it, especially on a Good Friday. So I'll start with you, Ramesh. You're the event organizer. Tell us about this medical camp.
Thank you. So the Ghanshyam Medical Camp is a brainchild of various organizations that came together. This happens to be our 13th medical camp in Uganda. We've had previous events in medical camps in Gulu, Kamuli, Jinja, Lira, Arua, Mukono, to mention a few. And this year we are fortunate enough to have one in Kampala, which will be held at the Swaminarayan complex in Bukoto. Because of COVID, we missed out on 2 years, and we thought we would make up for the lost time, and therefore we decided to host it in Kampala, where we have quite a number of vulnerable and urban poor population that we felt would really require these services. So one of the organizations that is spearheading this is called the Indo-Africa Charitable Society. It's based in Vancouver, Canada. It's headed by one of our senior most member called Mr. Vasant Lakhani, and he has been hosting these camps in Uganda with the help of other corporates and similar like-minded people. The other organization that has also joined us is ISSO SEVA, which is a charitable organization based in USA, with operations in Kenya, in Uganda as well, and in India, US to start with. Then we have got the Shree Kachi Leva Patel Samaj, which is one of the largest Indian community in Uganda. And we've been doing so many charitable activities, education, blood donation drives, food drives, clean water, among a few others. And then we've got the Sri Kach Satsang Swaminarayan Temple, which is a religious organization of these members of SKLPS that have been in Uganda for quite some time, and we believe this is our country, and we want to give back to the community in every little way that we can.
Well, I'd like to hear it. You come in here as well. What should Ugandans, those who are looking forward to this camp, what is it they can come, what kind of services should they expect?
Like, we are going to offer all kind of medications, like general medications, pediatricians, gynec, and other referrals. Like, you can say, for an example, if somebody needs to have a surgery, then we can refer with our partner hospital, that is Mengo Hospital and Mulago Hospital, where we are going to refer our patient, and they're going to treat from there as well. And it is not limited to Kampala itself.
I was about to ask that. If I
is,
heard about this and I'm embarrassed,
yeah, it's whole of Uganda, and like people who cannot afford this kind of services in the nearest hospital, who can come up with their paying transport up to here, and then they get a free services. So we are not only in this, basically in the general medications. As you know that we were having a pandemic called donation drive. In Kampala there is a scarcity of blood nowadays. So we try to emphasize this on blood donation drive, and we urge Ugandans to donate as many as they can to serve one of our human life.
Dr. Ezra, Mengo Hospital, I know you have championed some of the likes, medical camps. How do you come in this one?
So first I would like to thank our partners, Mahesh and Bipin this time, for always organizing this, because it's important to have these medical camps. Knowing the financial crisis we have right now, not many people can seek healthcare services. But importantly, I've been a champion for preventive medicine or wellness, clinics. People in Uganda or Africa per se do not really seek medical attention on time. So we're having a pandemic of hypertension and diabetes and obesity, and people do not really know what's happening. So it's in such camps that these things come out. It's in such camps that, we would get to masses. We're looking at 40,000 people plus. Now, for every medical camp, it must be supervised by professionals. And it's been a long time, that Mengo Hospital and the government of Uganda, the Ministry of Health, have been partnering with them to supervise, looking at the medical bits of it, because they have the heart to help Uganda, they have the heart to provide these medical services. But then we need to come in with the technical bit to look for the doctors, to look for what services are we going to offer, what is needed, how do we make the previous or the later one better than the previous one. So in this particular one, we've gone big. We've gone almost all services. We're looking at maternal child health, which is one of the most sensitive things in Uganda. That's looking at child care and obstetrics and gynecological conditions. We're looking at internal medicine, where internal medicine is a broad picture. That's my specialty. That's where I subscribe to. We're looking at hypertension, diabetes, stroke, heart disease, kidney disease, name it, the many conditions. We're looking at, this time we've added a special consideration for cancer patients because it's on the rise. So we're having lots of volunteers coming in from Ministry of Health, from Mengo Hospital, coming in to look at cancer as a very important core part of this. Now, we know we're in the pandemic. Last time when the president was talking about where we lie on the percentage of vaccination, we're still at 30%. We're looking at 75% for us to be safe in COVID vaccination. And when we say 75%, we're looking at people who have had at least 2 jabs and a booster dose. So in these settings is when we get people and tell them the benefits of the COVID-19 vaccination. There's been a lot of naysaying and, the vaccine has this, the vaccine has that. We want to give the facts. We're talking about medical facts and the proper facts. So it's in such settings that we offer this. And like Bipina said, we've had a scarcity of blood worldwide, countrywide. So it's now that we get many people who have never had the chance to donate blood. We collect blood and save lives, because just 1 pint of blood can save a life. You never know how important blood is until it's your relative that needs this blood. So that's added. Now we're adding optics, and optics we're looking at 2 things. The eye checkups, but also optics. We're trying to measure people's, eyesight, and those who need specs, those who don't need specs, sieving them out. We're looking at dental services as well. We are adding something that we are coining the wellness clinic. And Mengo Hospital has a wellness clinic, which we want to bring here, just part of it. For example, I'll ask, when was the last time you had your blood pressure taken? When was the last time you had your sugar taken? When was the last time you had, your chest looked at? When was the last time you had your, just not because you're sick, but just because you want to know how you are. It hurts when we see, and I've seen quite many of them, 25, 30-year-olds come in with hypertension and the kidneys are failing because of the hypertension they've had and not been, worked on. So in these instances, this is when we are picking up these people and saying, look, we need to encourage you to, good health habits. And finally, we're looking at TB, checks. TB is something that has not been well understood, and now we are seeing it's varying. We thought it was only in HIV patients, but now it's coming in HIV competent patients and coming with complications. So when we talk of TB screening, we definitely have to talk of HIV and AIDS, counseling and guidance. So it's going to be a whole package. And we're saying 12 days, 1st to 12th, because we want to have as many people as possible. And I wish to thank you and NBS for partnering with us to, let people know, because you're the biggest media house in Uganda right now. So I believe almost 70% of people will watch this and know, oh, there's a medical camp. come August.
Ramesh, I want you to come in here. It's 13 years you've been doing this. What are some of those ongoing trends that you see, in terms of diseases, in terms of upcoming ones, the ones that are going down? What are those trends that you see for the 13 years of experience that you've been doing this?
As Dr. Ezra rightfully mentioned, we've had all sorts of cases, and you will not believe that the smallest of medicine that we would, me and you in Kampala would have access to is not available in the rural areas. And these small illnesses become very big complications. So this is what we are trying to target, and like Dr. Ezra has mentioned, over the past 2 years, because of COVID, people have not had the time or are worried of not going to the hospitals or do not have access to these basic facilities. This would be their platform. So in the past, just to recap, like the last camp we had was in Jinja, and we reviewed almost 27,700 patients. We had 6,266 children who had pediatric care immunization child. We did 5,631 eye scans, in which also about 160 operations were done, all free of charge again. And then we had about 2,330 dental surgeries. And we also, over the weekends when the doctors have their free time, they also visit some of the schools and educate our children about dental health, and also distribute free toothpaste, toothbrushes, and basic hygiene skills. So this helps the general population to understand and improve their way of life, and ultimately cut down on their expenses in terms of medical care. So some of the medicines and the medical drugs that we're getting is also from donors. Some, of course, brought in by...
So there'll be free medicine as well?
There'll be free medicine. There will be free surgeries in severe cases. There will also be free aftercare. After the operation, all the aftercare will also be taken care of by these organizations. So we'll try to be inclusive in nature when we handle any of the patients that come to the camp.
Bipin, who are we targeting? What do they need to come with when they come? Because you're saying 12 days, this is all going to be. Do you just walk in by yourself? Do you have to come with something, national ID?
Not really, but like we are expecting those people who have been treated before the camp, they are going for a review now. So those people who will come also, and those who are sick but they don't know where to go. So they will come and consult over here, and then they will come to know the right place to go. Like for example, some of them are sick with the internal injuries or something. They don't know. Even we are having an oncologist this time, so they are going to consult with the cancer patient, because cancer patients you cannot come to know by body. So they are internal injuries or something. So from there they will come to know, and then they will guide us from there. All the patients, all dental patients, all pediatric patients or gynec patients would come over there, and they will be guided accordingly what they are facing with the problems. And in 12 days, not only this, like as Dr. Brazes explained that we are going to screening the TB as well, and we are having a HIV testing as well, facilities there. So we have partners in that case also. So we are going to have all kind of patients who are going to be treated in these 12 days.
So can anyone walk in?
Please, anyone can come over there, anyone. It is not for particular communities or particular for Kampala itself. It is for, as I told you earlier, that it is open for all communities.
Is 12 days enough?
Yes, it is.
If it's an open door policy,
It
12
is,
days
because
within-
we are targeting 40,000 patients.
Okay.
So probably over the 40,000 patients. And if we get more than 40,000 people, we are ready to help them as well. And we are going to serve them as many as we can in 12 days.
Well, 1st of August, those who are watching and you're looking forward to this, is a date. But Dr. Ezra, before we conclude, what is it that Ugandans fear about checkup? Because it's something that you've mentioned, that you actually asked a question, when's the last time you actually genuinely wanted to know how you're doing, until you feel something. And most of the times we'll even go and try to solve that small thing at the counter before we even find out. What is it in our mannerisms that we find hard to get to find out how we are?
I've had many patients come to me and tell me, when I get to know I have cancer, then I die. A lot of naysaying. My mother always tells me, do not go to a barren woman to ask how to give birth. If you want to know how to give birth, go to someone that has had many children. The issue in Uganda are naysayers. You know, someone will have had something from somebody. I'll give an example, typical example. When they take off a biopsy from you from a swelling, you die. They would have been told that someone had this biopsy and they died, and so they will tell someone so surely that if they take off that biopsy, you're going to die. So the issue is, one, people fear to know, because they think when they know, then the disease is going to move faster and then they'll die. It's important to know how you stand. The earlier we catch most of these conditions, the better. I'll give another example. Cancer Institute handles about 80,000 to 100,000 cases per month of cancer. Above that. But 70% of those annually are stage 4 or end stage disease, meaning they can't do anything. Had they caught this earlier, these are people they would have saved. I'll still give an example. I have many patients I can talk about. In Mengo, we've been seeing lots of patients coming in with end-stage kidney disease, end-stage liver disease. Why? Because they did not go for these checkups. So it's our plan, our partners, Mengo Hospital, Ministry of Health, and health workers, my particular passion, to encourage people to know how they stand. It doesn't mean that when you get to know of something, it will kill you. Actually, what kills you is worry. So when you get to know about your condition, the state of mind will come into play. If you tell yourself, I'm going to survive, you survive. You tell yourself, I'm doomed, you're doomed. So I want to change this narrative in Uganda and among Africans. I want to change it that Africans do not seek health care. I want to break and scratch that and say, look, you need to know how you stand. Like we've been saying, know your HIV status. You need to know your blood pressure status, your sugar status. You need to know your weight status. You need to follow up on these conditions. For example, ladies who are, every lady who has given birth, pretty much, do you know your cancer, your cervical status? Because many of them are coming with cervical cancer. Had it been caught early, they would have been saved. So I'm putting emphasis on people should know how they stand, but importantly, people should come and get free services, surgeries, free medicine, free checkups, a consultant, volunteer consultant, services. This is something that you have to pay a lot of money for, but it is free of charge for 12 days, free of charge. So again, I'll not stop thanking the partners, our partners, Ramesh and between Mengo Hospital and Ministry of Health and NBS, because these days knowledge is power. So if people get to know about this, then many more. I'm looking to 50,000 people, 60,000 people coming to seek healthcare services. You know, every block that I add on people knowing their status is important. So, I mean, please know your status.
Thank you so much. Bipin, your last remarks as we conclude.
I would like to thank NBS for being a partner with Ghanshyam Medical Camp, and by viewing this and by providing a media services, so we could not reach in up countries, and since you have provided with the different languages like a Swahili and Orion Gole, I think, and you have given us the platform to reach out with the people who are in Karamoja or in Soroti or in Bale, because we are expecting people from there as well, because over there we are lacking with the medical facilities. So obviously people will come up from there to get the free medical services.
Ramesh, as we conclude, where are you going next? I know. I'm asking where you're going next after here, because I know places like Karamoja, they have a nodding syndrome, and since offering such a good, this is a good cause, I would love to see my people from there also.
Sure.
Is that where you're going next?
Well, of course, if our partners and with the support of the government, we would try and we're trying to form a synergy or partnership with the government. Yes, government is supposed to do its job, but with the help of the citizens, it could deliver better services. And so that's what we're trying to do. And volunteers, we have Agrawal Hospital that is helping us. We have the Baroda Dental Clinic that is also helping us. Just to mention a few, Tata Uganda also has come in and is helping with all the logistics. So we appreciate all the corporates coming forward, and yeah, we appeal to every Ugandan, every corporate body that is available to come and support us in one way or the other. And yes, let's try to make this camp as successful as it can be while we deliver health services to our people.
Well, ladies and gentlemen, that is the Ghanshyam medical camp. It's starting on the 1st of August, going for 12 days until 12th of August. They'll be offering free reviews, free medicines, free surgeries at referral hospitals, and free aftercare. I know the times are tough, the economy is tough, and so if you're not feeling well, this could be the time you take up this opportunity and come and know your health status. Ugandans, let's change that. Victoria Bagaya is my name. I'll leave it here for now. Good morning.